Hello, my name is Bränström and I work as a researcher at the Karolinska Institutet, and I'm very excited to be invited to speak today about my research. I would like to show you some pictures, so I will start with sharing my screen. Sharing my screen and start a PowerPoint presentation. Right, so today I'd like to talk a little bit about some of the research that I have been involved with relating to why are LGBTQ people at increased risk of mental health problems, because that's questions that we have been trying to deal with in my research group during the last couple of years. So, and why is that? Well, one of the main reasons is that there's been a lot of research lately showing that LGBT people have an increased risk of mental health problems, and also so there's reason to trying to understand why that is. And I'll begin with showing some numbers from Sweden. This data comes from a survey conducted by the Swedish Public Health Agency, and they send out invitations to participate in a health survey or regularly, and it's random samples of the population in the age group 16 to 84 years. And they also ask questions about sexual orientation and gender identity. So in these surveys, in general, about 92% or so identify or say they identify as heterosexuals, and then 1.2% say that they identify as gay or lesbians, and 2.6% identify as bisexuals. There's also a question about transgender experiences, something like, are you or have you been transgender, with a definition of what that what they mean with that. And in general, about 0.7% say that they have such experience. And that is similar to what other population estimates have shown internationally as well. So it seemed to be around that number. So as you can see, there's small proportions of the population that identify as sexual minorities and report experience as a gender identity or gender minority individual. So in this survey, there's questions about several aspects of health. For example, the questions make it possible to categorize people into those who have elevated depression symptoms. And when we look at the data here, so here we have the different groups: heterosexuals, gay and lesbians, bisexuals, and those who report a transgender experience. And these are the proportion reporting elevated depressive symptoms. So about 16% of the population among those identified as heterosexuals claim that they have elevated depressive symptoms. Almost twice as many, 30%, among those identifying as gay and lesbian, and even a little higher among those identifying as bisexuals. And 32% in the group who say they have a transgender identity also report elevated depressive symptoms. So quite a lot of increased risk, about twice or a little higher risk of depressive symptoms within the LGBT group here. There's also some questions about suicidality. One question about past 12-month suicide thoughts and past 12-month suicide attempts. Here the proportions are smaller, but the increased risk in these three groups, bisexuals, gay and lesbians, and transgender individuals, is the same or even a little higher, almost 3 times as common among these groups compared to those identifying as heterosexuals and cisgender. And you can see the similar pattern for suicide attempts. And this is similar to what international studies have shown. But this is also a survey where we can link these survey responses to treatment data. So we have done that, and we were interested in understanding, so is it so that people are, because this is self-reported information, but is it also that these people are getting treatment for mental health problems to a higher extent? So we looked at that data. So it's the same people, basically, the same survey, but we're looking at registry information about treatment for depression, treatment for anxiety disorders, and treatment for substance use disorder. And when we look at depression, we see a similar pattern. We see that gay and lesbians, bisexuals, and trans people all have an increased risk compared to heterosexuals. And the same is true for anxiety disorder. When it comes to substance use disorders, it's fewer or a smaller proportion receiving that type of treatment, but still a little higher. The prevalence is still a little higher within the LGBT groups. So this is really telling us even more strongly that there definitely is an increased risk in both reporting and receiving treatment for mental health disorders within the LGBT group. So the question then is why, and what can we do about it? Why are LGBT individuals experience poor mental health? Well, many of the studies trying to understand this use predictors or risk factors that can be organized in different levels. At the structural levels, risk factors that have been studied are things like living in a country with discriminatory legislation, with limited access to healthcare, or also living in a cultural context or environment that is hostile with negative population attitudes, for example, towards LGBT people. And that is believed to increase the likelihood that you're exposed to different interpersonal stressors, things like victimization, threats, or discrimination. And being exposed to this type of stressors are believed to also influence different individual level things, like the likelihood of concealing sexual orientation to try to avoid these types of victimization and discrimination. Stress of negotiating also concealment in different contexts, but also stress around expecting to be exposed to negative events, and also internalization of society's negative attitudes, like internalized homonegativity of different sorts. And all these factors are believed to contribute to the increased risk of mental health among LGBT people. And many studies now also show that this is true. Several of these factors are strong predictors of negative mental health. And I would like to share some of the studies that we have been looking at to try to explore these factors. I will begin with one study looking at the structural level, looking at discriminatory legislation and population attitudes, things at a country level, actually, to try to see how that is influencing the mental health of the population living in those countries. So to study this structural level, we went to a survey that was conducted last year. It's a large scale study. It's, I think, 130,000 people across Europe that responded to this survey, and it included lesbian, gay, bisexual, trans people, and also intersex people they were trying to recruit. So it's a big group of people contributing with information in this survey. It was conducted by the European Union Agency for Fundamental Rights, and they have reported some of the research, some of the results from this survey on their web page. I think in in May this year. So you can check it out on their web page, but I will also present some here. What we were interested to understand, we wanted to look at the structural level factors. So what we did was we tried to code each country depending on the structural stigma context, or giving them like a score based on how stigmatizing they were, both when it comes to legislation and attitudes. To collect information about legislation, we used the ILGA map. ILGA is an organization that collects this information from all countries across the globe, but ILGA Europe makes this map that gives each country, well, in this case, a percentage of how that reflects their legal and policy human rights situation in each country. So the green countries are the more positive when it comes to LGBT rights and non-discrimination, and the red countries are those who are worse. So we use this information and combined it with attitudes in the population, and we used then information from attitude surveys. We use data from the European Social Survey, which is done every other year in most European countries, or a lot of European countries at least. One of the questions that they ask in this survey is, are gay men and lesbians should be free to live their own life as they wish? And this is a proportion who in each country on average that agree. So in Sweden it's like over 90% agrees with this statement, and the same is true in Netherlands and Norway and UK. However, in Eastern European countries like Estonia, Poland, Czechia, far fewer agrees that gay men and lesbians should be free to live their life as they wish, and in Russia only about 15% agrees. And as you can see here, we plotted these countries based on also their discriminatory legislation coming from this ILGA score. So you can see also that there's kind of a pattern here, that with worse legislation, there's also worse population attitudes. So a link here. Another question that was used in the data set was, if a close family member would be gay or a lesbian, I would feel ashamed. And here is the proportion who agrees with that statement. So very few in Norway and Netherlands that are also low stigma when it comes to legislation and policy, according to this index that we used, about 5% would feel ashamed, but almost 70% of the population in Russia claims that they would feel ashamed if a close family member would be gay or lesbian. So a huge difference in attitudes across countries. What we did was that we combined information about discriminatory legislation with negative population attitudes and created a country-level stigma score, as we called it. And we used that to plot the different countries and see what the mental health situation looked like in the LGBT people who responded to the EU-LGBTI survey last year. We used then a measure of depression, like last 2-week depression symptoms. And these are the proportion reporting elevated levels of depression in the different countries. Plotted on here on the x-axis is this country-level stigma score. So high score, high stigma, low score, lower stigma. So you can see that in Netherlands and Denmark, that ended up on the lower end of our stigma scale. About 20% reported elevated depressive symptoms during the past 2 weeks, which is high too, I would say, but maybe more similar to what population average would look like. However, there's a clear link here with stigma, and in more higher stigma places like Macedonia, Poland, Latvia, and Lithuania, around 40 or even higher proportion of the LGBTI population reported depression symptoms. So we saw a very clear pattern here, which is maybe not surprising, but still I was a bit surprised to see this very clear pattern when it comes, because many things influence your mental health and your depressive symptoms. But clearly, the environment in which you live, the rights you have, and how people around you, the attitudes they have against you or towards you, seem to be quite highly influential of your mental health. So this gives a strong support for the model that I just showed you, with risk factors at different levels influencing the mental health of LGBTI people. So the conclusions really from this study was that LGBTI individuals' mental health varies greatly across countries in Europe, and the variation can vary to a large extent be explained by the structural climate or environment in those countries. And of course, this really highlights the importance of reducing structural stigma and trying to change the situation when it comes to LGBTI rights and attitudes in the population, to try to reduce the risk of mental health problems within this group. But also, until that is reached, until everyone has equal rights and tolerant attitudes, we might need to also develop tailored affirmative psychotherapies that can address the stresses around the structural context surrounding sexual minorities in high stigma context, to try to improve the mental health situation there. Now I've been talking a lot about structural level and the environment at a country level when it comes to legislation and population attitudes, but I would now like to shift and look more at risk factors at the individual and interpersonal level, and also looking at some data here in Sweden too, because many would regard Sweden as a relatively low stigma context when it comes to like legal rights and attitudes too. In this study, we looked specifically at suicidality, which is an area where a lot of studies have shown that LGBT people are at increased risk. In this study, we used this theoretical model looking at factors at structural, interpersonal, individual level, but in particular, we wanted to see. So several studies have shown that suicide risk is definitely influenced by things like victimization, threats and discrimination, and several of these things too. But we also wanted to look at so we also knew that these factors influence depression and substance use, and depression and substance use are also risk factors for suicide. But we also wanted to look at more rather well-established risk factors for suicidality that hasn't been looked at as much within the LGBT context, things like barriers to societal integration. And many studies have shown that being married or living with a partner is a protective factor for suicidality. Not living with children is a risk factor. Lack of societal trust, how you trust other people around you, is also a risk factor for suicidality, and being unemployed. So we wanted to put this in the context of trying to explain sexual minorities' increased risk of mental health problems. The material we used was data from this nationwide population-based health survey conducted by the Public Health Agency of Sweden. And we used a couple of years to kind of pool together those numbers. It was people 16 to 84 years. A total of almost 60,000 individuals completed the survey. I talked about this earlier, the proportion of sexual minorities, but the measures that we used were past 12-month suicide ideation and attempts. The predictors or risk factors that we wanted to study was both psychological risk factors, things like depression and substance use, interpersonal risk factors, things like discrimination, victimization, and lack of social support, that we believed were important to explain the increased risk within sexual minority group. And we also looked at several what we call barriers to societal integration: not being married, not living with children, lack of societal trust, and being unemployed. So we put this into an advanced statistical analysis, and I won't go into all the details here, but what was clear was that all of our risk factors, both psychological, interpersonal, and barriers to social integration, was strongly related to suicidality, both attempts and suicide ideation. And most of them were also much more common among gay and lesbians and bisexual as compared to heterosexuals. So LGBT people were more likely to report depression, substance use, discrimination, victimization. Victimization was actually not significantly more common among gay and lesbians, but it was for bisexuals. Lack of social support was more common among both gay, lesbian, and bisexuals compared to heterosexuals, and being married and partner were less common. And not living with children was also more common among LGBT people. Lack of societal trust was more common among the bisexuals, and also being unemployed were more common among the bisexuals. So what we found was that using all of these risk factors to try to explain the increased risk of suicidality, we were actually able to explain most of the difference between sexual orientation groups. And so many of these factors are important in the explanation of suicidality and should be targeted to successfully prevent suicidality within this group. However, these societal integration factors are maybe more difficult to target with preventive efforts. And maybe we need to think of other ways to change norms around what societal integration looks like. So our conclusions was really that barriers to societal integration represent an under-investigated mechanism of the fairly large sexual orientation disparity we find in suicidality. It confirms the important role of sexual minority exposure to psychological and interpersonal risk factors. And it also extends research in different on causes of the higher prevalence of suicidality within sexual minority group. During the spring, we have also tried to look at the transgender group in a similar fashion, and really have found a similar pattern when it comes to risk factors of suicidality for trans individuals. Preventive intervention should support sexual minority and transgender communities to challenge outdated and overly rigid definitions of societal meaning and purpose, to ensure that such pursuits themselves are valued, and maybe we need to question the current norms around societal factors. That was a study looking more into the individual interpersonal factors that are important to understand mental health among LGBT people. But what can then be done to improve mental health among LGBT individuals? Well, if these other risk factors, and we find increasing support that these are in fact explaining the increased risk, we should be able to target these. And social action is really a way to try to influence factors at the structural, environmental level through activism, knowledge dissemination, and also increased visibility are things that can influence attitude, population attitudes, cultural norms, and of course legislation as well. And this should lead to increased likelihood of being exposed to these things like discrimination, victimization, assaults. So very important to continue and work with increased visibility, and these events like Pride events are of course extremely important, both to mobilize activism, but also to mobilize for increased visibility. But we could also look at more individual factors, and there's been quite a lot of research trying to understand mechanism, how are these individual stressors leading to mental health problems. And some of the mechanisms that have been identified are things like cognitive, emotional, and behavioral things that makes these stressors increase the risk of mental health. Things like hypervigilance, rumination, social isolation, avoidant behavior, and substance abuse that are more common among LGBT people with problems with mental health. And these mechanisms are things that effective psychological intervention can intervene upon. So lately, there has been several attempts to try to develop LGBTQ affirmative psychotherapies, and several of these are now being evaluated, both in high and low stigma settings. So we will know much more about how effective these targeted or LGBT affirmative psychotherapies are in the future. So hopefully that will help to support this group and reduce the increased risk of mental health. Some final conclusions. LGBTI individuals are faced with increased risk of mental health problems in Europe and globally. And this recent research has definitely begun to increase our understanding of the sources and mechanisms behind these disparities. And these results that I just showed you with structural level, stigma being an important predictor of mental health is of particular importance, of course, when we see that several countries are going in the wrong direction. Many countries are definitely improving both the legislation and attitudes, but several countries are also going in the wrong direction with declining acceptance in the population and more discriminatory legislation. The challenge to reduce these disparities in the future is definitely like in our hands, and we should research, lead our decisions and actions with the aim to ultimately eliminate mental health disparities based on sexual and gender identity. Some of the research that has been done has been summarized in these reports that I like to recommend. It's published last year or in the Swedish by the Swedish Research Council for Health, Working Life and Welfare, FORTE. And if you're interested in psychotherapy or work with this group, I can also recommend this book. It's a handbook of evidence-based mental health practice with sexual and gender minorities that recently was published, giving a very good overview of different programs and strategies to try to support mental health within this group. Okay. Thank you so much for your attention, and please contact me if you have questions or want to get involved in the research we're doing in this field. Thank you so much.